Hey everyone, welcome back to the channel. I'm Dr. Healthy Hub, and I'm here to help you better understand your body and take control of your health with simple, practical advice that truly matters.
Today, we're talking about a problem that many people experience, but very few feel comfortable discussing. Have you ever gone to the bathroom feeling like you desperately need to have a bowel movement, only to sit there for 30 minutes, maybe even an hour, with nothing happening? The pressure builds, the discomfort gets worse, and no matter how hard you try, your body just won't cooperate. Eventually, you give up, frustrated and exhausted, hoping things will get better later. But then the same cycle repeats itself again and again. If that sounds familiar, this may be much more serious than ordinary constipation. In this video, you'll learn what really happens when stool becomes trapped in the rectum, why this condition becomes especially dangerous as we get older, and most importantly, the exact steps you can take to handle it safely and prevent it from happening again. We're going to break everything down in a simple, easy-to-understand way. No confusing medical language, just real explanations and real solutions. And before we begin, I want you to know something important. You are absolutely not alone. Millions of people silently struggle with this issue every day. So if this topic feels familiar to you, type yes in the comments. Your comment could help someone else realize they're not alone either. Now, let's get started. Imagine a long, winding river. For years, that river has flowed beautifully. The water moves steadily. Everything downstream gets what it needs. Now imagine that over the course of a week, very gradually and very quietly, the water slows down. Maybe there was a dry spell. Maybe some debris began to pile up in a narrow section. The river does not stop overnight. It just slows and slows until one day the debris has compacted so tightly at one particular bend that the water literally cannot flow through anymore. That is your colon. That is what is happening right now. The medical term for this is a fecal impaction. But let me tell you what that actually means in plain language, because I think the clinical term lets people underestimate just how serious this truly is. Your large intestine, your colon, is essentially a muscular tube. Its main job is to move waste material toward the exit, while simultaneously absorbing water from that waste. Under normal, healthy circumstances, this is a beautiful, almost automatic process. Waste moves, water is absorbed, stool stays soft enough to pass comfortably. But here is where aging changes the game significantly. As we get older, several things happen simultaneously in the digestive system. The muscular contractions that propel waste through the colon, those rhythmic squeezes called peristalsis, slow down. The nerve signals that coordinate those contractions become less efficient. Thirst sensation decreases, which means many older adults are chronically mildly dehydrated without even knowing it. Medications, blood pressure drugs, iron supplements, calcium channel blockers, certain pain medications, many of the most common prescriptions for older adults directly slow down bowel motility as a side effect. Put all of those factors together, and you have the perfect internal environment for stool to move through the colon too slowly, sit in the lower segment too long, lose too much moisture, and transform from something soft and manageable into something hard, dry, and essentially immovable. By the time it has been sitting for 5, 6, or 7 days without passing completely, it has dehydrated into what can only be described as a dense, solid mass. And when that mass reaches your rectum, the final storage section just before the exit, and it simply cannot fit through, you have a fecal impaction. The pressure you feel is real. The exhaustion from straining is real. And the fear that something is seriously wrong is also completely justified, because something is seriously wrong. If you're learning something new right now, take 1 second and hit the like button. Why this is far more dangerous than you think. I want to spend some real time here because this is the part that catches people completely off guard. People hear the word constipation and think inconvenient but harmless. fecal impaction is neither of those things.
Let me walk you through what begins to happen inside your body when a large, hardened mass is stuck in your rectum for an extended period. The first issue is structural pressure. Your rectum is not designed to hold a cemented, dehydrated mass indefinitely. It is a flexible structure, yes, but it has limits. When it is chronically overdistended, the blood supply to the tissue lining the walls of the rectum becomes compromised. The cells that line that wall need oxygen and nutrients from blood. When circulation is cut off or significantly reduced, those cells begin to struggle. In severe or prolonged cases, this can progress to tissue injury that requires medical intervention to repair. Now, here is something that genuinely surprises most people. Your rectum and your urinary bladder are neighbors. They share a very confined pelvic space, separated only by a thin, fibrous wall. When your rectum is packed with a solid, rigid mass and stretched well beyond its normal capacity, it physically pushes against the bladder.
For women, this pressure is often more pronounced due to pelvic anatomy. What patients experience is a sudden and confusing difficulty urinating, a feeling of constantly needing to go but only passing a few painful drops, or in severe cases, not being able to urinate at all. Some people become convinced they have developed a bladder infection overnight, when the real cause is a rectal impaction compressing the bladder from behind. Once the impaction is addressed, the urinary symptoms often resolve completely. But we are not done yet. There is one more symptom that must be discussed because it confuses people so profoundly that they actually end up making things dramatically worse. It is called overflow incontinence, and on the surface, it looks exactly like diarrhea. Here is what happens. The solid mass blocks the main exit, but your intestines are still producing liquid waste higher up in the digestive tract. That liquid has nowhere to go except to seep around the outside edges of the hard blockage, like water finding a crack in a dam, and it leaks out unpredictably. People see this liquid and think, well, I clearly do not have a blockage. I am having diarrhea. And some people tragically go to the pharmacy and buy an anti-diarrheal medication to stop it. This is one of the most dangerous mistakes you can make in this situation. Anti-diarrheal medications shut down the movement of your intestinal muscles. You will paralyze the very mechanism your body is using to try to work around the problem, and you can cement that impaction even more deeply into place. I strongly recommend you save this information right now. You may not need it today, but if this ever happens to you or someone you love, having this step-by-step guide could make all the difference. If you are experiencing what appears to be
In nursing homes and long-term care settings, some studies suggest that fecal impaction affects upward of 40% of residents. It is one of the single most common gastrointestinal emergencies in older adults. Yet it is also one of the most preventable when people understand what creates the risk in the first place. Let me give you the major risk factors specific to older adults. Reduced mobility is enormous. When we move our bodies, walking, exercising, even just standing and doing light housework, we mechanically stimulate the digestive system. The simple act of walking creates gentle rhythmic pressure in the abdomen that helps keep intestinal contents moving. When mobility decreases due to arthritis, recent surgery, a fall, or any other reason, that mechanical stimulation disappears. The colon slows down. Dietary changes are another key factor. Many older adults find their appetite decreasing. They eat smaller meals, they may eat less fiber, they may drink less water, partly because the thirst mechanism that tells us we are dehydrated becomes less reliable with age. All of these changes reduce the bulk and moisture content of stool, making it more prone to hardening.
Then there are the medications. This is a conversation every person over 60 should have with a healthcare provider or pharmacist. Many commonly prescribed drugs for older adults have constipation as a direct side effect. Opioid pain medications, certain antidepressants, antihistamines, iron supplements,
Calcium supplements in high doses and diuretics that increase fluid loss can all contribute significantly. If you are on multiple medications, the combined constipating effect can become substantial. Finally, there is the issue of suppression. Many older adults grew up in an era where talking about bowel habits was deeply taboo. They feel the urge to have a bowel movement, but they are not at home or it is not a convenient time, so they suppress it. Repeatedly suppressing that urge over months and years retrains the rectum to become less sensitive to the signal. The urge becomes less frequent, less urgent, and waste sits longer. Understanding your own specific risk factors is the first step toward preventing the situation from repeating itself. Before we go into the exact step-by-step solution, make sure you're watching this in a place where you can focus, because what you're about to learn could help you avoid an emergency room visit. The Emergency Action Protocol. All right, you now understand what is happening and why. Now, let's talk about what to do if you are in the middle of this situation right now. The very first instruction is this: stop straining. I know it feels instinctive. I know your body is screaming at you to just push harder, push more, try a different angle. But here is the physiological reality. A solid, dehydrated impaction does not respond to pressure from above the way normal stool does. It is too rigid.
What additional straining actually accomplishes is increasing the risk of hemorrhoids, anal fissures, or even a rare but serious condition involving a sudden drop in blood pressure from excessive straining that can lead to fainting. In older adults with cardiovascular conditions, aggressive straining can also place dangerous stress on the heart. Stop straining. Breathe and work through this systematically. Step 1. Glycerin suppositories. Go to any pharmacy, no prescription needed, and purchase adult glycerin suppositories. For a hardened impaction in an adult, a single suppository is often insufficient. Follow package instructions or guidance from a healthcare professional before using more than directed. Here is exactly how to administer them. Lie on your left side, not your back, not sitting upright. This position works with your anatomy, specifically the natural curve of the sigmoid colon and rectum, to help direct the medication toward the mass. Apply a generous amount of water-based lubricant to the suppository before insertion. Do not skip this step. The surrounding tissue is already irritated and sensitive. Lubrication is both more comfortable and more effective. Insert the suppository gently and deeply. Breathe slowly and steadily. And then, this is the part where most people fail. Do not move. Stay on your side. Stay still. Wait at least 30 to 45 minutes.
If you rush to the toilet after 10 minutes, you will very likely only expel the suppository itself, while the impaction remains exactly where it is. Step 2. The second attempt. If after that first round nothing significant has passed, do not panic and do not immediately start pushing. Get up gently. Walk slowly around your home for 15 to 20 minutes. Gentle movement stimulates peristalsis. Then lie back down and repeat the process. Allow another full 30 to 45 minutes. The second round is often what is needed to soften not just the outer layer, but to penetrate further into the mass and allow it to begin breaking apart. Step 3. Warm water retention enema. If 2 rounds of suppositories have not produced results, the next step before seeking emergency care is a warm water or saline retention enema, available over the counter in products such as Fleet enemas or similar options. Follow the instructions carefully. Lie on your left side, administer slowly, and again, hold it. Do not rush. The goal is to introduce enough fluid and warmth to further hydrate and loosen the impaction from above. Step 4. Emergency medical care. If all at-home attempts have been thorough and unsuccessful, and patience truly matters here, it is time to go to an urgent care facility or emergency room.
This is not admitting defeat. It is making a smart medical decision. At the hospital, medical teams have access to high-volume therapeutic enemas with medicated solutions that penetrate much more deeply into the colon than over-the-counter options. They also have imaging tools to assess exactly how extensive the impaction is and whether it extends beyond the rectum into the sigmoid colon or further. In cases where clinical enemas are insufficient, particularly with long-standing impactions, a specialist may perform what is called manual disimpaction. To be clear, this involves a trained medical professional using protective gloves and substantial lubrication to carefully break up and remove the impacted mass, piece by piece. Because the surrounding tissue is often extremely inflamed and sensitive by this stage, the procedure may be performed under sedation or regional anesthesia. It may sound uncomfortable, but it is a safe and routinely performed medical procedure, and many patients report enormous relief afterward. Recovery and what happens next. Once the impaction has been successfully cleared, either at home or with medical assistance, your body enters a brief recovery phase that requires care and attention. For the first 24 to 48 hours, the rectal tissue may feel irritated, swollen, or sensitive. Some discomfort, mild spotting, or a feeling of rawness can occur temporarily.
A warm sitz bath, soaking the lower part of your body in warm water for 10 to 15 minutes, 2 to 3 times a day, can provide significant relief and help promote healing. For the first few days, focus on easily digestible, soft, fiber-containing foods. Think oatmeal, cooked vegetables, ripe bananas, and soups with soft vegetables. Avoid foods that are dry, tough, or low in moisture, and drink water consistently throughout the day, even if you do not feel thirsty. This is also the right time to schedule a medical follow-up. Review your medication list with a healthcare provider to identify possible constipation-related side effects. If constipation has become a recurring issue, consider seeing a gastroenterologist for a more detailed evaluation of digestive motility. And if you are overdue for a colonoscopy, this may be an important time to rule out structural causes, such as narrowing of the colon or abnormal growths affecting passage. Long-term prevention? The foundation.
The goal is not just to manage a crisis. The goal is to build habits that help prevent this situation from happening again. Long-term prevention of fecal impaction in older adults rests on 4 major pillars. Pillar 1, hydration. Water is one of the most powerful tools your colon has for keeping waste soft. Aim for at least 6 to 8 glasses of water per day. If plain water feels difficult, herbal teas, broth-based soups, and water-rich fruits and vegetables can also help. Set reminders if needed, and make hydration a daily habit. Pillar 2, movement. You do not need intense exercise. A simple 20 to 30-minute walk each day can make a major difference for digestive health. If walking is difficult, gentle chair exercises or swimming can still help maintain intestinal movement. Pillar 3, dietary consistency. Soluble fiber from oats, fruits, legumes, and cooked vegetables help stool retain moisture and move more comfortably through the colon. Introduce fiber gradually if you are not used to a high-fiber diet to reduce gas and bloating. And try to keep meals consistent. Eating around the same times each day helps the digestive system establish a rhythm. Pillar 4, scheduled bathroom time. The gastrocolic reflex, the natural signal your colon sends after eating, is strongest in the morning, often within 30 to 60 minutes after breakfast. Try sitting on the toilet at the same time each morning, even if the urge is not immediate. Using a small footstool to elevate your feet slightly can help place your body in a more natural position for bowel movements.
Give yourself 5 to 10 relaxed minutes without rushing or straining. Over time, your body can relearn this rhythm. Try not to rely on stimulant laxatives as a permanent solution. While they can provide fast relief, long-term daily use may train the colon to depend on artificial stimulation.
There are often safer long-term options available, including osmotic agents, stool softeners, and fiber supplements that a healthcare provider can help you choose appropriately. I know this has been a long conversation, and some parts may not have been easy to hear, but understanding what is happening inside your body gives you the ability to respond early, make informed decisions, and seek help when needed. And most importantly, you should never feel embarrassed about dealing with this issue. If you found this information useful, consider sharing it with someone who may quietly be struggling with the same problem and not know where to turn for guidance. Take care of yourself. Drink your water, move your body.